Hey guys, so I have put together a little RFF Phalloplasty arm care and hand therapy guide. I kind of went over some of this stuff in my RFF Phalloplasty video of what to expect post-op. If you guys want to follow along, I have the arm care and hand therapy guide PDF available for download. Just head to the link below. It'll take you to my link tree, and there you can download it for free. And I also have top surgery and bottom surgery guides available for free download as well. Once again, a disclaimer that I am not a medical professional. I am just speaking from my own personal experience with RFF Phalloplasty. I had phalloplasty in 2021 with Dr. Meng Chen with the Bunkie Clinic. So let's go over what to expect, what you need to start doing right away, and I'm going to demonstrate the hand therapy exercises that I did in order to get my full range of motion back and to get my hand swelling completely down. So I woke up from surgery with a bunch of things attached to me. When it came to my arm, I had an IV, I had an arm drain, and an arm cast to immobilize and protect the graft. I was in the hospital for 5 days, and I was in a lot of pain. Don't want to scare you guys because not everybody has tons of pain. There's some guys who I guess don't have much at all. Apparently my pain tolerance is not very high. One of the worst things to feel though is the electric zaps that run up and down your arm. That's your nerves freaking out and reconnecting and healing. It's crazy. But it only really bothered me for the first week. I had to keep my arm elevated to help the swelling go down. They recommend that you keep your arm elevated for 5 to 6 weeks. So I always had pillows around me. You can never have too many pillows. And my hand really was very swollen. All of my fingers were swollen. I was told to schedule hand therapy ASAP. So I started hand therapy when I was 5 days post-op. You have to start right away because scar tissue is already developing. And once we took off the cast and they were, having me move, I could barely bend my wrist any direction. I could barely move my fingers. So the sooner the better. The sooner you start on your scar tissue, the easier it will be to tear through it, and the sooner you start on your hand swelling, the easier it will be to drain all that fluid down your arm. But once you start developing scar tissue in your wrist, that can block the fluid from draining. And that's why some guys will have hand swelling still and the kind of like that divot where it doesn't quite smoothly transition into the wrist. And some guys' hands stay swollen for a really long time. 1 to 2 weeks post-op, you can start gently washing the graft. Soap and water, and pat it dry. I highly recommend foaming Dove sensitive skin soap. It's very gentle on the incisions. Then you'll reapply the dressings. And I needed assistance doing this because, one, it's really difficult to do with just one hand. And I was still so weak that I would almost faint every single time I would get up and have to do any kind of physical activity. And also the graft was really hard to look at in the beginning. Ooh, I thought top surgery was bad. Whew. And then I made sure only to put Aquaphor on the graft before I put the dressings back on. Aquaphor is your best friend. It will keep the graft from drying out. And then also at this time, 1 to 2 weeks post-op, that's when you gently begin the active range of motion exercises with the wrist and the forearm. 2 to 5 weeks post-op, you can wean yourself from wearing the arm cast. Definitely still wear it anytime you go out. So post-op appointments, if you're going out to walk, wear it to protect your graft. At this time, you're also going to continue your range of motion exercises, but more aggressively. And then you will continue to protect your graft with dressings, Aquaphor, and any ointments that your surgeon approves. Now, around 6 to 8 weeks post-op, your wounds should start closing up. And once my wounds healed, I wore a compression sleeve with silicone sheets underneath on the scars daily. Clean arms, no lotion, nothing on the arm at all. Silicone sheets, compression sleeve. You can do that daily for a year. I stopped, I think around 6 months. And then at night, I would take off the compression sleeve, take off the silicone sheets, rinse those off, let them dry overnight, and I applied bio oil to my graft. As I've said before, I did 6 months of hand therapy, and it was so worth it. I got my full range of motion back, all of my strength, my grip strength, and we also worked through releasing the scar tissue on my arm because it was adhering to my tendons, my muscles. It was very tight. I couldn't even rotate. And then I was also given homework. So basically, I had to do exercises and scar tissue release movements while I was on bed rest at home. And diligently doing that every single day helped the hand swelling go away. Now, also, if you have really bad hand swelling, they can prescribe you a special mesh compression glove. That's what I got, and it covered here through here. So my fingers came through, but right here it was just a lot of compression, and that also helped with my exercises while I was draining the fluid out of my hand. So around 6 to 9 months, that's when I started to notice that, my graft was smoothing out. So I stopped with the silicone sheets and the compression sleeve. And so what I started to do daily was I would apply a water-based lotion, which is basically any lotion where the first ingredient is water. And then I would follow that up with cocoa butter twice a day. Now, you definitely have to protect the graft from the sun for at least the first year. I always wore sunscreen, and then I wore a Tattoo X sleeve. No compression, just the sleeve to cover it up from the sun. And if you guys are looking at the guide right now, there's also a timeline on there and then a list of supplies specifically for your arm that I've included. And then if you keep scrolling, I have 2 scans from a packet that I received from the Davies Campus Hand Therapy Center right after stage 1. And there's pictures on there of some of the hand therapy exercises that I did. So once I was given the okay, I started working on my hand swelling. The easiest thing, prop your arm up, your elbow up on a pillow. All I did was push from this side and push from this side, and then wrapped my hand around my hand, if that makes sense, and push down through my arm. And I did that multiple times in different angles, and then each individual finger. I didn't think it would do anything, really. I didn't think it would really work. But I'm telling you, doing this made a huge difference. I did this all the time. I was constantly moving liquid through my wrist, draining my hand. And I could see the hand swelling going down. The weird thing is the skin on my hand and my fingers started peeling off. And that's just because that was just extra skin. Like, that's something that took me a while to get used to, was just my hand constantly peeling. But it wasn't as full anymore, so it didn't need all that skin. So, and then every day I would just compare. Not swollen, swollen. Okay, it's getting closer to normal. We're getting there. So that was the main thing that I did to get the swelling down. The hand movements and keeping my arm elevated for 5 to 6 weeks. Now I'm gonna go over the range of motion exercises to get my strength and range of motion back. So this first exercise is called tendon gliding and intrinsic plus exercises. Do I really know what that means? No, but these exercises worked and they helped. So you're going to do 5 different movements. First movement, according to this paper, is called straight. So straight up like this, which is actually hard because my hand was in a splint like this, and my hand was curved. So I actually, it took effort to straighten out my hand. Like, it was really hard to do. Straight, and then you hold that for 5 seconds. The second movement is called hook. So you just bend the tops of your fingers. I don't know if you can. I'm never gonna be a surgeon. I am way too shaky. From another angle, just the top of your fingers. And then you hold that for 5 seconds. Then you move on to fist. So you just bring it down into a fist. Thumb up. Hold that for 5 seconds. Then you move that into straight fist. So you just straighten out those fingers, flatten them out as much as you can. Try to get them as low on your palm as possible. Hold that for 5 seconds. And then the last move is tabletop. So then you just straighten it out like this. I'm so shaky. Hold that for 5 seconds, and then you repeat it over again. I was told to do this 5 times a day, 10 repetitions. So that whole cycle, 10 times. That's 1 session. And I had to do that 5 times a day. Easiest thing was just to set a timer to remind me. So it looks something like this. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And then you go back up again. From this angle, 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Don't be hard on yourself. If it's difficult in the beginning, if you're very shaky, that's how I was in the beginning. But the more that I practiced, the more excited I got to go show my hand therapist, look what I can do. The other exercises are called adduction/abduction and opposition, which is thumb to tip. Let me explain. So with the adduction and abduction, you're basically spreading the fingers apart and putting them back together. Again, it looks easy, but it's very difficult after surgery, but it will get easier. And then the opposition, which is thumb to tip, you're just going to touch your thumb to the tip of each finger individually and try to keep the other fingers completely straight. Try not to bend them while you're doing this. Keep them up. These are really easy exercises that you can do while you're on bed rest, while you're recovering, and as simple as they seem, they are extremely important and very helpful. Do not skip your homework. Do not skip your hand therapy exercises. If your therapist tells you to do something, trust me, listen. Scar tissue is no joke. Now, I don't have these tools with me right now, but I'll try to include a picture of them on the screen. When I worked with my hand therapist, she used a lot of different tools on my arm. There was a metal tool that I ended up getting as well that I pushed down into the scar tissue, and that used to hurt so bad, but now the scar tissue is not adhered to everything below. But we used metal tools to push and break down that scar tissue. I also had a plastic roller. It was a little tool with a little plastic ball that just rolled around, and I would just roll it around the entire scar to soften it. Really made a big difference. Also just massaging in one spot and pushing down. You'll feel the scar tissue. You'll know when it's stuck. You can feel it, and you can feel it tearing. But just doing a little bit of that massage every single day will add up over time. And gradually you'll start feeling looser and looser. In the beginning, I couldn't bend my wrist like this in either direction, so I had to use my other hand to push, and I would feel it right here. It hurt so bad, but using my other hand helped break through that scar tissue. Same with this. And helping like move it like this. And my therapist would also do the same things with her hand. She would hold my hand and be like, okay, now push. Give me all the resistance that you've got. And in the beginning, I had no strength, and then gradually got that strength back. And I do get asked this question a lot. I don't have any problems with putting weight on my wrist, my forearms. I'm able to go to the gym. I'm able to lift just fine. I can do push-ups. I can bend my wrists fully. My scar does not bother me like I thought it would. So yeah, that's pretty much it. I'm sure there are plenty of other exercises that you can do. These were the exercises specifically given to me from my team and from my hand therapist. They worked for me. I really hope that they work for you guys. And I wish you guys the best of luck on your own bottom surgery journey if you so choose to go down this path. It's been very rewarding for me. Thank you for watching, and I'll see you guys in the next video.